crizotinib versus standard chemotherapy, such as pemetrexed or docetaxel, in advanced non-small cell lung cancer that have as a molecular marker a genetic lesion that drives the tumor, an ALK rearrangement or ALK activation. And Alice will give you more details on it.
Thank you. Good morning. In the last decade, it's become clear that lung cancer is not a single disease. There are, in fact, many different subtypes of lung cancer that can be defined by changes in key cancer-causing genes. One of these genes is ALK, or anaplastic lymphoma kinase, which is abnormally activated or turned on in 3 to 5% of lung cancer patients. With an estimated 1.6 million new cases of lung cancer worldwide each year, this relatively small percentage still translates into over 50,000 new cases of ALK-positive lung cancer every year. Crizotinib is the first clinically available targeted therapy pill for ALK-positive cancers. In 2 earlier single-arm studies, crizotinib induced significant and durable tumor shrinkages in the majority of patients with advanced ALK-positive lung cancer. Based on crizotinib's high response rate in these 2 studies, its favorable side effect profile, and the generally limited benefit of standard chemotherapy, crizotinib has already been approved in many countries for advanced ALK-positive lung cancer. However, a head-to-head comparison of crizotinib with standard chemotherapy to show superiority of the targeted therapy has never been done until now. So shown here is the study design for Profile 1007, a randomized phase 3 study of crizotinib versus pemetrexed or docetaxel chemotherapy in patients with advanced ALK-positive lung cancer. This study was a global study involving over 100 sites in 21 different countries around the world. The target enrollment was 318, but we actually enrolled a total of 347 patients. All patients had advanced ALK-positive stage 3B or 4 non-small cell lung cancer and had received 1 line of prior chemotherapy. Patients were randomized 1-to-1 to crizotinib or to either standard pemetrexed or docetaxel chemotherapy. The primary endpoint of the study was progression-free survival, with response rates, overall survival, safety, and patient-reported outcomes secondary endpoints. Of note, patients who were initially randomized to chemotherapy and had progression of disease or worsening of disease were allowed to cross over to receive the targeted therapy crizotinib. As shown here, Profile 1007 met its primary endpoint by showing the superiority of crizotinib over chemotherapy in prolonging progression-free survival. Median PFS was 7.7 months with crizotinib as compared to 3 months with chemotherapy. The hazard ratio was 0.49 in favor of crizotinib, and the difference was highly statistically significant. Consistent with these results, the response rate was tripled with crizotinib compared to chemotherapy, 65.3% versus 19.5%. In terms of overall survival, interim analysis showed no difference between crizotinib and chemotherapy. However, this analysis was immature and was clearly confounded by crossover of patients in the chemotherapy or control arm. Safety analyses showed that most side effects with either crizotinib or single-agent chemotherapy were mild and manageable. But importantly, based on questionnaires that were given to patients during the course of the study, there was better symptom control and quality of life with crizotinib compared to chemotherapy. Shown here are the results of quality of life analyses showing that for global quality of life, as well as for other domains relevant to quality of life, there was significantly greater improvement from baseline when patients were treated with crizotinib compared to chemotherapy. So to summarize, Profile 1007 is the first randomized trial comparing crizotinib with standard chemotherapy in a specific type of lung cancer, ALK-positive lung cancer. Compared to single-agent chemotherapy, crizotinib more than doubled progression-free survival, more than tripled the response rate, and improved symptoms and quality of life. The side effects that we observed with crizotinib were consistent with its known safety profile. So taken together, these results establish crizotinib as the standard of care for patients who have advanced, previously treated ALK-positive lung cancer. Thank you.
Thank you, Alice. This is very important because, as you have seen, when a driving mutation, a driving genetic alteration in a subset of tumors is found, and we have a specific selective inhibitor, then we see a major difference. And this is an important step forward, the personalization of care. Now, what we